How's it going, guys? We have a medium difficulty question for toxicology, steps 1 and 2. 46-year-old man brought to emergency 3 hours after consuming a bottle of brodifacoum, rat poison, and a suicide attempt. Works in construction, normally drinks 2 beers a day, smokes 5 cigarettes daily, appendectomy at the age of 10 years. What's most likely to develop in this patient in the next 72 hours? Choice A, bleeding diathesis, correct answer. USMLE wants you to know that rat poison is one of the 3 vignettes they're going to give you for vitamin K deficiency. So there's a million different types of rat poison out there if you Google it. But the one USMLE wants is that it causes bleeding diathesis similar to warfarin. Okay, you don't need to memorize this drug. I just wrote it here because I don't need one random pedantic student saying, OMG, it could be this other type of rat poison, etc., which could cause this different finding. Okay, we need to be very clear here, but you don't need to memorize the drug. But I want you to know the 3 vignettes for vitamin K deficiency on USMLE. Number 1, rat poison acts like warfarin, causes bleeding diathesis. Okay, so inhibits vitamin K epoxide reductase. Warfarin prevents the recycling of vitamin K, and of course, vitamin K cofactor for gamma glutamyl carboxylase, necessary for the activation of claudin factors 2, 7, 9, 10, anti-claudin protein CNS. But the second and third vignette, second will be a neonate bleeding from the umbilical stump. Okay, vitamin K deficiency, sterile bowels in neonate. You can sometimes get conjunctival blotches. It's not shaken baby syndrome if they mention bleeding from the umbilical stump. The third vignette is going to be patient who's been on broad spectrum antibiotics for at least 6 weeks, e.g. for endocarditis, and the patient might be on warfarin at the same time. They want to know why the dose of warfarin required is less in that patient, and the answer would be something like vitamin K deficiency due to depletion of bowel normal flora. Those are the 3 vignettes. Okay, neonate, umbilical stump bleeding, 2, broad spectrum antibiotics depleting your large bowel flora, and 3, rat poison on USMLE. Let's just whip through the other answers real quick. Choice B, DVT, wrong fucking answer. USMLE could be oral estrogen containing oral contraceptive pills. Classically females who are smokers over 35 and migraine with aura. Obviously other things like history of thrombotic disorders, etc., but those are the 2 highest for USMLE, smokers over 35 and migraine with aura. Estrogen upregulates fibrinogen as well as factors 5 and 8. That's the mechanism for thrombosis effects, hypercoagulable state with estrogen, obviously HRT as well. Okay, it's not used. It's not used for any other purpose apart from severe vasomotor symptoms. That's because HRT, not only does it increase the risk of breast cancer, but it also increases the risk of DVT, MI, stroke. Wrong fucking answer. Choice C, diabetes insipidus, wrong fucking answer. So nephrogenic DI, for instance, lithium, demeclocycline, and then hypercalcemia can cause it. Shows up in an NBME question. Students get it wrong. They're like, what the fuck? Hypercalcemia can damage the kidneys, cause nephrogenic DI. And then 4, NSAIDs. Okay, obviously NSAIDs usually things like pre-renal azotemia can cause interstitial nephritis, but 1 out of 20 questions, it shows up. They want you to know that it knocks out the effects of ADH at the kidney. Choice C, wrong fucking answer. Choice D, prolonged QT, wrong fucking answer. Antipsychotics, metoclopramide, okay, that makes sense. D2 antagonist, same as antipsychotics. Macrolides like azithromycin can prolong the QT. TCAs prolong the QT, e.g. amitriptyline. Wrong fucking answer. Choice E, thyroiditis, wrong fucking answer. Amiodarone, type 3 antiarrhythmic potassium channel blocker. Lithium as well, drug-induced thyroiditis. Okay, a lot we can talk about, but if you've gone through my endocrine content, you know I've discussed that even if you're hyperthyroid in a setting of drug-induced thyroiditis, you'll have decreased uptake if they ask you. Okay, so for Dequervain, for postpartum, and for drug-induced, if they give you the hyper variant, because they can also cause hypothyroidism, but if they give you the hyper variant, you're going to select decreased uptake, whereas, for instance, something like Graves, toxic multinodular goiter, toxic adenoma are all increased uptake. Choice E, wrong fucking answer. You know the deal. I'm team more content, like my subscription. Appreciate your time. That's it.